Hi, I'm Kurt Veely. I'm a senior statistical scientist at Berry Consultants, and we have several speakers talking at the Society for Clinical Trials meeting in Vancouver in May 2025. We wanted to give them all a chance to talk about their talks and give an intro to where they're going. And if you're going to be there, hope you will join them. We'll start with Barbara Wendelberger. She'll be talking about platform trials for chronic diseases. Barbara.
Hi, yes, Barbara Wendelberger. I'm a senior statistical scientist here at Berry Consultants. I will be speaking in a session titled Harnessing the Potential of Platform Trials in Chronic Diseases on Tuesday, May 20th from 1 to 2:30 Vancouver time. And my talk will focus on adaptive trial features and other clinical innovations within platform trials. I will be talking about the pathway to prevention platform trial in alpha-synuclein disease, which is a precursor to Parkinson's, and also exploring some of the multifactorial approach that we use in REMAP ILD, which is a REMAP style platform trial for interstitial lung disease.
All right. We also have Giorgio Paulon, who will be talking about enrichment trials.
I'm Giorgio. I'm a statistical scientist at Berry Consultants. My session is titled Planning Heterogeneous Treatment Effects, Enrichment for Treatment-Sensitive Patient Populations. And it will be held on Wednesday, May 21st, between 11 a.m. and 12:30 p.m. This session will discuss how adaptive clinical trial can respond in real time to the emergence of heterogeneous treatment effects. So you can imagine that oftentimes a therapy tends to benefit more subgroups and subtypes of patients compared to others. And so enrichment refers to a strategy that is used to select participants that are more likely to experience the benefit of the therapeutic intervention. What I will be presenting in particular are two trials, one that actually reached its conclusion and posted its results, where enrichment was successful. And then starting from the lessons learned of the trial, I will also talk about the design of the follow-up trial to that.
And finally, we have Tom Jensen, whose title worries me a little bit because it involves stopping progress.
Hi, I'm Tom Jensen. I'm a biostatistician at Berry Consultants, and I will be speaking in a session titled Stopping Progress, Finding Effective Treatments Using Disease Progression Modeling. This session will be held Tuesday, May 20th, from 4 to 5:30 p.m. Pacific. And the content of this particular session is 4 talks involving how do we better account for disease age in our analyses? How do we select both meaningful and efficient endpoints? What I will be speaking about is how do we account for informative intercurrent events, including mortality, by leveraging some neat statistical modeling, particularly joint models, in addressing that. And finally, how to appropriately define a treatment effect.
Sounds great. I encourage everybody to attend. I'm sure these talks will be wonderful, and I appreciate all of you joining me today.